All right, this next chapter is chapter 4, disorders of the cervix and uterus. We're going to start out with cervical lesions. Cervical polyps. These are finger-like growths that start on the surface of the cervix or endocervical canal and can protrude through the cervical os. They're typically much darker red in color, and they can bleed. They're associated with chronic inflammation, an abnormal response to increased levels of estrogen, so we see them more commonly during pregnancy, or they can be as a result of thrombosed cervical blood vessels. These are typically through the columnar epithelium of the cervical canal. They're more common in older and multiparous women. They, on physical exam, appear smooth, red or purple finger-like projections from the cervical canal, and they really have no adverse impact on the pregnancy. Management. You can remove them by gently twisting them with a ring forceps or by tying a surgical string around the base and amputating it that way. Or you can use an electrocautery or a laser, although that is usually not necessary. An antibiotic may be given after the removal, even if there are no or few signs of infection, because it is often associated with a chronic infection, and send the tissue to pathology. Here's what it looks like. And you can see this is the speculum, this is the exocervix, and you can see protruding through the cervical canal is this fairly generous sized cervical polyp. Now this one looks lighter in color, but look at the next one. You can see the distinct difference. This is stratified squamous epithelium, and this is columnar epithelium. Columnar epithelium has capillaries one cell from the surface, and so they appear more reddish and they can bleed easily. And yet the effect on the pregnancy is pretty minimal, if any. Now, Bothian cyst is another cervical lesion. This is an asymptomatic mucus-filled cyst on the surface of the cervix. Now, this is typically on the stratified squamous surface. The mucus-producing glandular cells become covered by squamous epithelium through metaplasia. And this is typically found then on the transformation zone. Remember, the transformation zone started out as columnar epithelium, and then as exposed as it was to the acidic vaginal secretions, through a process of metaplasia, the columnar epithelium got transformed into squamous epithelium. If the glandular cells underneath are still present and are producing mucus, they can then push out the squamous epithelium and distend it into what appears a cyst. Small white pimple-like elevation, more common in multiparous women, and they are really asymptomatic. This is the cervix. This is the ectocervix, and you can see here we have an elevation of the stratified squamous because of the mucus buildup underneath. This is quite a bit larger one, which is right here. And again, it is benign, has no malignant potential, and can be basically ignored. Although if you don't know what you're looking at, you'd say, my goodness, looks like we have a tumor there. This is eversion of the cervix. And what this is columnar epithelium from the endocervical canal, which has come out onto the ectocervix. It is a different color. You can see it's more of a reddish color because it's columnar epithelium and the capillaries are just one cell from the surface. But there is nothing anatomically wrong with this. Cervicitis is inflammation of the cervix, and this is in contradistinction to the upper reproductive tract, which would be a acute PID. So this is in the lower reproductive tract. Etiologies typically are sexually transmitted disease, including gonorrhea and chlamydia. What you will see may be a friable bleeding mucosa or a mucopurulent vaginal discharge. Now, friable means that when you touch it, it bleeds very easily. Now, the eversion is a redness of the cervix, which is columnar epithelium, but if you touch it, it shouldn't bleed. If it is infected and if it is weakened, it can bleed. If it is a gross infection, you can get a mucopurulent cervical discharge, and let me show you what that looks like. The diagnosis is made by DNA probe. Management is by appropriate antibiotics, and we'll talk more about this under pelvic infections. This is your mucopurulent cervical discharge, and you can see this pus which is coming out of the cervix. This is not your clear water of Niagara, although this looks like a waterfall that's frozen. This is pus, and gonorrhea, chlamydia frequently can cause this. Here you can see is a cervicitis, and you can see the irregular areas of bleeding here. This is from an infection on the exocervix. You can see here there is also areas of bleeding as well. And that's the end of cervical lesions.